So today I'm going to be talking about something very, very important, okay? And it's called halitosis, okay? So that just means bad breath. I'm sure most of you, maybe you've seen people that have bad breath, and then you kind of feel uncomfortable around people that have mouth odor and all that. But today, I'm going to teach you everything on mouth odor and how to treat it, okay? So when you're trying to talk to somebody and then the person is just closing their nose or the person is moving away from you, it can be really, really embarrassing. So I want to help you, okay, so that you understand why that happens and you know what to do whenever it happens, okay? So halitosis basically means mouth odor or bad breath. Okay. So now there are different types of halitosis, okay, but I'll just talk about some today. Not so much, just a few, okay. So the first one is what we call a genuine halitosis, okay. So under the genuine halitosis, that's where you have the physiological one. And when I mean physiological, I mean it's natural. Okay, like when you wake up in the morning, you're like, and then you notice that there's this smell that comes out. So that's a natural one. Okay. Second type of the genuine halitosis is the pathological halitosis. Okay, so that one is because it's caused because there's a disease. Okay, so it could be maybe the person has maybe heartburn, or maybe the person has a dry mouth. Okay, or the person has a hole in the teeth. Okay, so it can cause a bad breath. Okay, so that's under the genuine halitosis. Okay, so there are some psychological ones. So the first one under the psychological one is what we call the halitophobia. Okay, so this basically what it means is that this type of people, they are afraid of having bad breath. Okay, not just the halitophobia. Okay, you also have the pseudo halitosis. Okay, so what pseudo halitosis means basically is that, of course, from the name, pseudo means false, right? So the patient or the person is telling you that my mouth is smelling, but you, as the person that you are trying to tell, is not smelling anything. Okay, so it's a psychological thing. Okay, so that is under the different types of words halitosis. Okay, so yes, let's dive in. So first of all, before I start, I would like to divide the causes into two. You have the local causes and you have the systemic causes. Okay. So now the local causes, first of all, is that you have a poor oral hygiene. Okay, so what that means basically is that you're not brushing properly. Okay, especially your tongue, and that's where you have like loads and loads and loads of bacteria. Okay, on the tongue and also food particles as well. Okay, so poor oral hygiene, and not just even on the tongue. You have food that gets accumulated in between the teeth. So when you don't floss, I mean, food is going to accumulating between your teeth. Okay, so number one cause for oral hygiene. Okay, so number two is when you have like tooth decay, or like people that have holes in their teeth. Okay, so what happens basically is that you have a very gigantic hole in your teeth, or in your tooth rather. Instead of you to go to your dentist, you're like, "Ah, it's not paining me, yes, it's not doing this, it's not doing that." Guess what, that hole gets bigger. Okay, and what happens is that bacteria goes there, calls its family and friends. Okay, and then whenever you take in food, anything sugary, anything starchy, anything you take in, it goes in there, the bacteria acts on it, and then of course releases some chemicals. Okay, and even over time, those food that are even accumulated there, they rotten, and then it releases some very, very bad smell. So that's what also causes bad breath. Okay, so that is under the local causes, right? So I will move to the systemic causes. For systemic causes, you have some food like garlic, beans, onions. They can cause bad breath. Okay, and not just that, there's some people that have dry mouth, what we call halitosis. You notice that if your mouth is always dry, you know those type of people, they can also come down with what, dry mouth. Why? Because number one, I told you saliva is very, very important. It helps to moisten the mouth, and not just that, saliva helps to neutralize acid, okay, from maybe the bacteria or the whatever. Okay, saliva helps to neutralize that. But now if somebody is deficient of that saliva, obviously the person is going to come down with what, halitosis. Okay, and again, that dry mouth can be due to maybe people that have a problem with their salivary glands. Okay, so that's another cause. Then you have some people that have uncontrolled diabetics. They can come down with what? With mouth odor. And you have some people that also fast. People that do like dry fasting, 6 to 6. What happens there is that your body breaks down fats, okay? And then it breaks down fat. Once it breaks down fat, it releases something called ketones. Okay, so that's what can also cause bad breath. Okay, and then the main culprit of this bad breath, there are some bacteria. Okay, they are gram negative anaerobes. Okay, example of that is what Preferomonas gingivalis. So what happens there is that this bacteria basically releases chemicals. An example of that chemical it releases can be hydrogen sulfide. Okay, so that's just what is responsible, and then there are other chemicals as well that are really other substances. Okay, so now we'll move to the next thing. Okay, how to treat it. So basically, you need to know what causes your mouth odor before you even know how to even treat self. Do you understand? So that's why, but things like the following things I'm about to say can help. For instance, you having a good oral hygiene. So when you're brushing, please brush properly, and please do not ignore your tongue. Your tongue is very, very important. Okay. You make sure you hydrate properly. So always take frequent sips of water. Right? Keep yourself hydrated. Avoid sugary food. Make sure you floss. And lastly, please see your dentist regularly. Right? Thank you.